Hello and welcome. My name is Jill Rotella, and I am the Research Information Volunteer for the Nebraska Southwest Iowa JDRF chapter. My passion for JDRF comes from my son, Louis, who's 20 and at age 8 was diagnosed with type 1 diabetes, also referred to as T1D. I'm so excited to bring to you today Michaela Olstein. Michaela is here to share her story with us about participating in a Teplizumab trial. This trial has been a labor of love for JDRF. Teplizumab is a disease-modifying therapy that can prevent the onset of type 1 diabetes for up to 3 years. There are autoantibodies in the blood that can be detected with a blood sample. If your blood work comes back showing that you have 2 or more autoantibodies, then you are identified as being in stage 1 to the progression of a type 1 diabetes diagnosis. There are 3 stages prior to a final type 1 diabetes diagnosis and insulin dependency. Michaela, welcome. And thank you for sharing your story with us today. Can you tell us a bit about yourself?
Hello, my name is Michaela. I am 19 years old and I am a student at Brigham Young University in Idaho.
Oh, wow. Congratulations. It's a great school. So I understand that your sister was diagnosed with type 1 diabetes, which led you to be tested for the T1D autoantibodies. Can you tell us about that?
Yes. So at the time of my sister's diagnosis, I was 14 years old. And during that time, we decided to get our blood work done, recommendation of the doctor. In that time, I was tested positive for 4 out of the 5 antibodies in my immune system out of my entire family.
Wow. So having 4 of the autoantibodies would put you in that 3rd and final stage prior to a T1D diagnosis. That's heavy news, and you were only 14. Tell us what went through your mind.
At the age of 14, it's the time where all teenagers want to be normal and try to act normal and don't want anything to screw up their lives. And during that time, my sister got really sick and we were moving and it was a whole mess. And I thought I was never going to be normal again. I was so scared. I didn't want to end up like my sister. And luckily, I was able to pull through in the end, but it was one of the most terrifying experiences in my life.
I can imagine. So how did you find out and become involved with this Teplizumab trial?
So at the time, I was moving to Florida. And luckily, the research center in Colorado that we started at was able to transfer all my records and move me to the University of Florida Research Division. There, I met the type 1 diabetes president of the association, and he was able to set me up with the trial.
So what gave you that final push to decide to participate?
The final push was my sister and my mom, because they were my biggest helpers through that 2-week period. And my sister was so excited to be able to help others with her condition. I thought I might as well be a part of that process. If I can help others before they get it, that's the greatest gift I can give.
Yeah, wow. Tell us about the process of the infusion and what was it like?
So the process is a 2-week process. I come into the hospital every day for 2 weeks, and the process is about 4 to 6 hours. I am in the hospital room while they inject either the drug or the placebo into my body, and they stay there to make sure I am healthy and don't get an infection.
And so you did not receive the placebo, you received the actual Teplizumab
Yes.
infusion. And now how many years out are you from that initial 2-week infusion process?
I'm 5 years.
Wow, that's incredible. And to think that you were so close to a T1D diagnosis, and here you are 5 years later, still free from insulin and the daily maintenance of this disease. How has this impacted your life?
Luckily, I've been so grateful for it, for I've gone throughout all of high school and now 1 year of college free of diabetes. Luckily with my sister, I know what it takes to manage type 1 diabetes when I eventually get it down the road, or I can help others with it. And I know it's a 24-hour management and there's no time off. My sister is my beloved hero, and I admire her for her bravery and strength.
Michaela, that's an amazing story. And thank you for your courage and bravery. You are forever part now of groundbreaking history. Because of your part in this trial, you have and will forever change the lives of so many. So you are our hero.
Thank you so much.
Will soon become the first ever disease-modifying therapy for type 1 diabetes. JDRF has funded more than 15 grants over the past decade and has been the lead on this clinical trial. This is the first ever study in humans to show the delay of the onset of type 1 diabetes. We are so proud to announce that FDA has Teplizumab under priority review with a target date of July 2nd for 2021. This timing is so crucial because studies now show that 85% of new diagnoses do not have any prior family history. Anyone can be tested for these autoantibodies through our T1D Detect initiative. This research and clinical trial was and is possible thanks to the generosity of JDRF donors who continue to fight for a world without T1D. Thank you for your support as we continue to improve lives today and tomorrow by accelerating life-changing breakthroughs to cure, treat, and now prevent T1D and its complications. Michaela, thank you for your amazing part in making this all possible.
Thank you so much. It's an honor to be a part of this.
And it was an honor to meet you. Thank you so much. I'm so excited to share you with our community here.